Let's talk about pain management. For this section, we're focusing on our pretty sick patients, right? Cancer patients and sickle cell patients, people with, very high amounts of pain or chronic pain. Signs and symptoms are going to be different if it's acute pain or chronic pain, if it's mild, moderate, or severe. So, somebody in acute severe pain, maybe even high on the moderate scale, they're going to have an increase in their vital signs, most likely. Their heart rate's going to go up, tachycardia, tachypnea, and hypertension. We can also assess their, numeric scale 1 to 10, their faces scale. Um, but physically, you're going to probably see some facial grimacing, some guarding of the area, maybe moaning, sweating, um, things like that. There will be some physical signs and symptoms of acute pain. For chronic pain, it might not be as easy to see. They may have some vital sign changes like hypertension, but they might not have an elevated heart rate or tachypnea. Their physical signs and symptoms might not appear that they're in pain because they're dealing with this chronic pain all the time. So they're kind of adapted to it. They might not be grimacing or, guarding or look like they're in a lot of pain, but it's because that they've been dealing with this for a long time. So there may be some more subtle physical signs and symptoms like weight change, either weight loss or weight gain, sleep disturbances, depression, fatigue, um, just things like that. Doesn't mean that they're not in pain. It's just chronic pain is a little bit more difficult to assess. So, for our mild and moderate pain, we can do non pharmacological measures like repositioning, massage therapy, guided imagery, distraction, aromatherapy, all of those things that you learned in the beginning of nursing school that we hardly ever do because we just jump straight to the drugs. But they can be very helpful for somebody who's in mild or moderate pain. Once you get to severe pain, we're probably going to need some pharmacological intervention. And medications, we're going to be giving NSAIDs, Tylenol, aspirin, the easy stuff in the beginning if it's mild pain, if it's moderate pain. For our chapter or our module, we've been discussing, cancer patients. So we got to be careful if they have bleeding disorders, and we're going to give them NSAIDs, right? So like Motrin or Toradol. Got to be worried if they're possibly thrombocytopenic. But for these more moderate or severe pain complaints, we're going to go straight to the opioid analgesics. Dilaudid, morphine, those would be very common for the acute care setting, like in the hospital, even at home if they're, you know, cancer patient or they're on hospice or something like that. They could be on Dilaudid and morphine. More likely, once we switch them to PO medications, it's going to be like oxycodone, maybe Norco. Oxycodone's a very commonly prescribed cancer pain medication. Cancer pain is severe pain, so we need to treat it aggressively. So get familiar with Dilaudid, morphine, oxycodone, Percocet, Norco, things like that be often prescribed. So we got to know adverse effects, side effects, normal doses. Mostly what we're going to be watching out for is like CNS depression, respiratory depression, hypotension. Those would be side effects of these very strong opioid analgesics.